Welcome to another question and answer session. This is the physiology portion. Which of the following statement relating to the blood transfusion in surgical patient is false? The options: packed red cell typically have a hematocrit between 55 to 75. Clotting factor activity in whole blood decrease sample stored for longer than 7 days. After 3 weeks, stored blood pH occurs 6.9. Gamma irradiated blood products are not required routinely. Patient should be transfused to achieve target hemoglobin of 10 gram per deciliter and hematocrit of the 30%. So let's see some important information here. First of all, the indication of the blood transfusion. When there is more than 8, there is no indication. There is no indication of the transfusion, but commonly it is commonly practiced that the surgeon or medicine specialist, they want to keep the hemoglobin level 10 gram per deciliter. For this, they usually prescribe the blood transfusion, but when there is more than 8, no need of the blood transfusion. Also, when there is 6 to 8, there is unlikely to benefit. But when there is 6 or less than 6, in this condition, the benefit from the blood transfusion. And blood transfusion, it is nothing but an organ transplantation. So it should be given very carefully. For this condition, blood should be transfused when the hemoglobin level less than 6. And here we can see patient can generally be managed without transfusion as long as hemoglobin 7 or greater. So when the hemoglobin percentage 7 or greater, in this condition there is no requirement for transfusion of the blood. But when there is 6 or less than 6, in this condition transfusion may help. The exact level depends upon the patient factors such as the comorbidities. Whole blood function less effective. That means in whole blood they are less effective, because in whole blood there are different clotting factor reduced, WBC flatulate, their half-life finish and they are reduced. Only RBC present, but there is anaerobic glycolysis occurs in case of the RBC, so there is development of the lactic acid. So in the first option, packed cell typically have hematocrit between 55 to 75%. It is true. It is usually true. It is 55 to 75%. Clotting factor activity in the whole blood decrease if sample is stored more than 7 days. Actually, it is true, because the clotting factor, they have very short half-life. So when we keep in stored form, so the clotting factor, they are reduced, they are absent from the blood. After 3 weeks, stored blood pH becomes 6.9. It is also true, because when we are storing the blood, anaerobic glycolysis occurs in the RBC, lactic acid develop. For this condition, pH reduced from 7.35 and it become about 6.9. So it is the acidic form related to our body. Gamma irradiated blood product are not used routinely. It is also true, because routinely we are not irradiated the blood products such as the whole blood, fresh frozen plasma, hematocrit concentration or platelet concentration. They are not irradiated. They are just screening for certain infection like hepatitis B, hepatitis C, HIV, syphilis or gonorrhea, this type of the infection. So the gamma irradiation is not a routinely practice. Patient should transfuse to achieve target of 10, which is misguide all time, and it is not true, because blood is transfused when there is the hemoglobin percentage 6 or less than 6. Thank you all.